Have you ever looked at your morning coffee and thought, I wish this could fix my erections? You're not alone. Many men quietly notice a change. Erections are weaker. Desire is there, but the body does not follow. It can be frustrating, sometimes even embarrassing. And the hardest part? You still feel young inside. You still want love, intimacy, and confidence in your own body. I'm Dr. Rosalia Viterbo, urologist, and I want you to know something important. Erectile changes are common. They are not a sign that you are less of a man. They are a sign that your body, and especially your blood vessels, need attention. In this video, I'll show you one simple change. You start with your usual morning coffee. Then you add a specific ingredient, something urologists talk about because it supports blood flow and nitric oxide. No, it's not a magic cure. It will not replace medical treatment when you need it, but it can be a powerful ally, especially if you're in your 50s, 60s, or even 80s. We'll talk about how this coffee boost works, who can safely use it, and when you must not rely only on coffee and should see a doctor if you want stronger, more reliable erections again. If you miss your old energy and confidence, stay with me. Let's start with your morning cup. Let's be honest. For many men, erection problems do not happen overnight. They creep in slowly. First, you notice it's harder to stay firm. Then sometimes you lose the erection midway. Or you need more and more stimulation just to get started. At first, you might ignore it. You blame stress. You blame a bad night of sleep. Maybe you blame your partner. But deep down, you feel something has changed. Does this sound familiar? You still have desire in your mind, but your body is not responding the way it used to. This can affect more than just sex. It can touch your confidence, your mood, your relationship. You might start avoiding intimacy. You might feel guilty or ashamed. Some men even fear their partner will stop finding them attractive. But here's what many men don't realize. Erections are not only about testosterone, they are about blood flow. They are about tiny blood vessels that must open properly. They are about nerves that must communicate clearly when those vessels get stiff or narrow, when blood flow is reduced. The penis is often the first place to show a problem, sometimes years before the heart or brain. So yes, a weaker erection can be a warning sign of high blood pressure, high cholesterol, diabetes, or simply years of stress, poor sleep, smoking, and inactivity. The good news? You can support your erections. You can help your blood vessels work better, starting with small daily choices. One of those choices can be your morning coffee, not because coffee is a miracle, but because when combined with certain nutrients, it can gently support circulation, nitric oxide, and energy. Before I tell you what to put in your coffee, you need to understand what is happening inside your body. When you know the why, the what to do becomes much easier. First, let's understand what a healthy erection really needs. An erection is basically a blood flow event. Blood must rush into the penis. The small arteries need to open up. The veins must close just enough to keep the blood in. For that to happen, your blood vessels release something called nitric oxide. Think of nitric oxide as a relax signal for the vessels. It tells them to open. When they open, more blood flows. Age, smoking, high blood pressure, diabetes, and stress can damage those vessels. They become stiff. They stop responding well. So the goal is not just more testosterone. The goal is better vessel health and better nitric oxide. That's where your coffee can help. Now let's talk about what urologists are excited about. The ingredient is simple: unsweetened dark cocoa powder, not chocolate syrup, not sugary hot chocolate mix, just pure cocoa powder. The kind you use for baking with no added sugar and no milk powder. Why cocoa? Because cocoa is rich in compounds called flavonols. These flavonols help your blood vessels relax. They support nitric oxide production, and they gently improve circulation over time. You don't feel a rush like a drug. It's more like daily support for your vascular system. So, how do you use it? First tip. Start with a simple recipe. Prepare your usual black coffee, then add about 1 teaspoon of unsweetened cocoa powder. Stir it well. If you like, you can add a little milk or plant milk. Avoid adding a lot of sugar. Too much sugar harms your blood vessels. You can drink this once a day. Morning is fine. Some men enjoy a second, smaller cup in the afternoon if it doesn't disturb their sleep. If you're sensitive to caffeine, use decaf coffee and the same cocoa. The benefit is mainly from the cocoa, not just the caffeine. Second tip, combine your erection coffee with healthier choices around it. Coffee and cocoa alone will not undo a pack of cigarettes. They will not erase years of sitting all day, but they can be part of a bigger plan. When you drink your cocoa coffee, use it as a reminder. Ask yourself, can I move my body today? A 20 to 30-minute walk improves blood flow. It supports your heart, your brain, and yes, your erections. Simple leg exercises like climbing stairs or gentle squats also help circulation in the pelvis. Add more color to your plate: vegetables, fruits, olive oil, nuts, fish. These foods also support your blood vessels. Think of your cocoa coffee as your signal. Every morning, it reminds you, I am taking care of my circulation today. Third tip, protect your sleep and stress levels. Many men don't connect erections with sleep, but poor, short, or fragmented sleep can lower testosterone and increase stress hormones. When stress hormones are high, blood vessels stay more tense. The body stays in fight or flight, not rest and connect. So, along with your cocoa coffee, try a simple evening routine. Dim the lights 1 hour before bed. Avoid heavy meals late at night. Turn off screens at least 30 minutes before sleeping. If you like, practice slow breathing. Inhale through your nose for 4 seconds. Exhale slowly for 6 seconds. Do this for a few minutes. It calms your nervous system. It helps your body switch from stress to relaxation. A relaxed body receives blood better, and that helps erections. Fourth tip, know when coffee is not enough and you need to see a doctor. If you notice a sudden change in erections, if you have pain, if you also have chest pain, shortness of breath, or leg cramps when walking, you must not rely on coffee or cocoa alone. Erection problems can be an early sign of heart disease. They can point to diabetes or high blood pressure. Your urologist or family doctor can check your blood pressure, cholesterol, and blood sugar. They can review your medications. They can see if you are safe to use erection pills or other treatments. If you already take medicines for the heart, especially nitrates, never start supplements or erection pills without medical guidance. Cocoa coffee is gentle and generally safe for most people, but it is still part of a bigger medical picture. Finally, let's talk about expectations. Will cocoa in your coffee bring back the erections you had at 20? Probably not. But can it help your vessels work better, support nitric oxide, and, together with lifestyle changes, improve firmness and reliability? Yes, it can. Think in months, not days. Vessels heal slowly. Habits work over time. If you're in your 60s, 70s, or even 80s, you are not too old to benefit. Your body still responds when you give it the right signals. So, your job is simple: support circulation daily. Use your coffee as a tool, move your body, protect your sleep, manage your stress, and seek medical help when needed. You deserve intimacy. You deserve confidence. You deserve to enjoy your relationships at any age, and your morning cup can become the first step in that direction. Let's bring everything together. You started this video with a simple question. Can I really put something in my coffee to help my erections, even at 80? Now you understand the deeper picture. Erections are not just about desire. They are about blood flow. They are about the health of your blood vessels. They are about nitric oxide helping those vessels relax so blood can enter and stay in the penis. With age, stress, smoking, high blood pressure, diabetes, and lack of movement, those vessels begin to struggle. Erections become weaker, slower, or unreliable. This is not a sign that you are broken. It is a signal from your body, a request for better care. In this video, we talked about using your morning coffee as a small daily tool. We chose unsweetened dark cocoa powder, not sugary chocolate, not dessert drinks, just pure cocoa, rich in flavanols that support nitric oxide and vessel function. You learned how to add about 1 teaspoon to your coffee, how to keep sugar low, how to enjoy it once or twice a day, even with decaf if you're sensitive to caffeine. But we also made something very clear. Cocoa. Coffee is not magic. It works best inside a healthier lifestyle. Your erection coffee should be a reminder to move your body, to walk, to climb a few stairs, to add vegetables, fruits, healthy fats, and good protein to your plate. You also heard how important sleep and stress are. Without restful sleep and a calm nervous system, erections suffer, so your evening routine matters just as much as your morning cup. And finally, we talked about safety. If your erections change suddenly, if there is pain, or if you have warning signs like chest pain or severe shortness of breath, You must talk to a doctor. As a urologist, I want you to remember this. Your penis is sometimes the first place to show vascular problems. Listening to it can protect not only your intimacy, but also your heart and your brain. You deserve to feel confident in your body. You deserve closeness, pleasure, and affection at every age. So when you see your morning coffee tomorrow, don't just drink it on autopilot. See it as a choice, a small, daily way to care for your circulation, your erections, and your long-term health. If this video made you look at your morning coffee differently, that's a good sign. It means you're paying attention to your body. You're not ignoring the signals anymore. Remember, adding cocoa to your coffee is a simple, gentle step, but the real power comes when you combine it with movement, better food, good sleep, and medical checkups when needed. If you'd like more clear, calm, doctor-guided explanations like this, I invite you to stay connected. Subscribe to the channel, turn on notifications. That way, you don't miss the next videos where we'll talk about prostate health, testosterone, libido, and practical ways to protect your energy and intimacy as you age. You don't have to figure this out alone. I'm here to guide you with science, experience, and compassion. If you found this helpful, feel free to share it with someone you care about. Many men are struggling quietly and just need simple, trustworthy information to start making changes. Thank you for spending this time with me. Take care of your heart, your circulation, and your relationships. Take care of your health, and I'll see you next time.